Hello and welcome to Alliance Live, the information and learning portal which brings you examples of innovative and integrated working taking place across Scotland within health and social care. Today I'm joined by Jeff Macdonald, Chris Flynn and Janine Aitken, three Glasgow-based Community Links practitioners who are here to speak to us about their work, the impact of COVID-19 and some considerations for the future. Hello and welcome everyone.
Hi.
Hi there.
So first of all, Chris, could you tell me a little bit about what a Community Links practitioner actually is?
Sure. Well, the Alliance Community Links Practitioners, we work in 31 practices across the city of Glasgow. So we work in communities where it's recognised that there's maybe a higher level of complex health and social care needs and perhaps health inequalities present, often in relation to higher levels of socioeconomic deprivation within these communities. So we're all based in GP practices and individuals come to see their GPs. If the GP highlights that there's maybe some kind of social issues that are impacting on someone's health or ability to live well, they can refer on to the Community Links practitioner. Our process when we actually meet with someone is that it's all very led by the person themselves. So we may have issues identified by the GP that they've referred on to us, but what's important to us is to meet with the individual, listen to what's going on for them, and then that kind of guides our work and what we're going to be doing for that individual and with them. What we look at doing is hearing what's happening for someone and issues that they want to identify in their lives around their health or any social issues. There's no issues that we can't cover, because we then look at identifying relevant services within the local community, whether that's other statutory services, voluntary organisations or smaller community groups that are going to be useful for that person. Depending on that person's needs, we can signpost them somewhere, refer them to a place, support them along to somewhere in order for them to see if they want to engage with that service. People can come back to us and say maybe, no, that idea you came up with wasn't right for me, let's look at something else. So we have a very, very kind of open process that's fully led by the person. So alongside our work that we do with individuals and helping them kind of look at relevant supports for them, we also look at kind of building capacity within communities and maybe doing some joint work in between the different community organisations in order to kind of best meet the needs of the communities that they serve. We also look at, implementing a wider links approach within general practice as well. So looking at the general practice's ability to be aware of and utilise the wider services within their communities in order to kind of best provide services for their patients.
Thanks very much for that. So Janine, Chris has just been telling us about your work with the individual and with the community. Could you tell me, how has this changed or adapted because of the COVID-19 pandemic?
Well, we're continuing to work with people who are presenting issues that they would have had before the pandemic started, but we'll also be working with them in issues that have begun since the pandemic started, and that can be around food poverty or fuel poverty, prescriptions, needing dog walkers, kind of practical stuff. So we might also be getting new people who we haven't previously worked with, who are struggling with issues around poverty or social isolation now because of the pandemic. And so really the role we're still carrying out the same role, but it's just a different model. A lot of the work that we're doing is remotely. Supports are provided by telephone.
Thanks very much. So Jeff, Janine just gave us a bit of a flavour of how your work has changed. What kind of support have you found yourselves delivering at this point in time?
Thank you. We have provided a wide range of support with a variety of issues that affects people's health and well-being. We support anyone of any age with any issue that's registered at the individual practice where we're based. With the impact of COVID-19, there has been an increased level of social isolation and people have needed additional support with foods and medications. We've been linking in to support individuals who are shielding and are also vulnerable to ensure that they receive the essential foods and medication support they need, and also any other support that they might require. There has also been an impact upon home care services because of COVID-19. Services at home have been significantly reduced, so we have looked to provide extra advice and help to ensure that people get the support that they need during the crisis. Another important element is identifying gaps in services. We work innovatively to ensure that we arrange and link in with a wide range of different organisations and support to ensure that people receive the support that they want and that they need. When a person is referred through each individual practice by the GP or another member of the practice team, it's often for one specific reason. However, through discussion and having an opportunity for the person to be listened to and have their voice heard, it often transpires there are other issues that they may like to be supported with. We support people with a variety of social determinants of health, and the approach that we take is fully person-centred. It's really led by the person and what's important to them. It's completely flexible and open-ended. A person can receive support an individual time on a regular basis, or they can dip in or out depending on what's happening for them in their individual life. We look to support people at every step of the way, and the most important thing is trying to help people to live well.
Thanks very much for that. So we've spoken about how Community Links practitioners work, and also about how the way that you've worked has changed and adapted because of COVID-19, and the way that the support that you deliver has changed because of that. But Janine, could you tell me how, as a Community Links practitioner yourself, you've been supported through this time?
Fortunately, working within the Health and Social Care Alliance, there is a huge focus on health and wellbeing, and also particularly for the staff, because it is a very stressful environment, even out with the pandemic. So daily we receive information on self-care, lots of self-care strategies, and also we're all part of various WhatsApp groups, and that provides a type of support from all your colleagues or your seniors on a daily basis. You can just ask questions, or if you're not feeling great, you can really have a wee chat with people, stuff like that. And also we have access to regular supervision, and we also get to have regular calls with our line managers, just to have a chat and a catch up, and just really a kind of informal supervision to chat through any issues or concerns that we have. So we're all very fortunate in that respect.
That's brilliant, thank you very much. I think it's so important that as staff members, we're all supported within our work as well, because that really allows us to provide the support to other people. Chris, coming back to you, we've dealt with sort of what you did previously before COVID-19, and we've discussed a bit about how it's changed. What do you think needs to be in place in the future for you working as a Community Links practitioner, particularly during the sort of COVID-19 recovery period?
Certainly looking at us kind of moving back to our kind of more kind of normal way of working, then it's important that we look at the government and NHS Scotland kind of guidance on services returning to their previous ways of working, and certainly considering services within general practice. They are kind of being phased in gradually, the additional services that go into working practices. I think it's important for us to, look at the best way of working for us to carry on providing support that we have been doing throughout the COVID-19 crisis, looking at increasing our face-to-face contact, which is what we are used to, and the very, unique and special thing about our job is the time that we spend with individuals, and looking at getting balance, between that and also staff wellbeing as well, and looking at, the safest way for us to return to work. I think it's important, that we see some recognition of the smaller services that we link in with that have made a huge effort during the COVID-19 crisis in providing supports to communities. These are often organisations that maybe struggle to get funding or longer term funding, and I'd like to see recognition of the contribution that they have made. And I'd like to also, ensure that we are, aware of these services to kind of feedback to the larger bodies like government or the statutory agencies on the difficulties that they are facing. So kind of ongoing kind of consultation with our practices and how wider services are returning to normal is going to be really, really important with us, and working in conjunction with the practices that we're in. We're in 31 different practices who are all, their own individual bodies and all have different ways of working. So it's important for us to consult with them, find the best way of them to work with us as we return and get back to our normal, very close working relationship with them, and look at, what's best for the individuals we're going to be working with and also our staff and their well-being during that process.
Thanks, Chris. There's some really important points there about recognising the contribution of smaller services and also promoting partnership work as we go forward. So thank you for that. Jeff, Chris has just told us there about what you need as community links practitioners, but in your view, what do the people that you support need as we go into the COVID-19 recovery period?
I think it's important that people receive consistent support, especially during an uncertain and challenging time, as we've experienced during lockdown. We have adapted the Links Worker programme very quickly with no disruption to our vital support service that we provide. Lockdown has brought a variety of challenges to usual services and also changes. We've helped people with a wide variety of issues, including accessing food, essential medications, help with home care support services, receiving gas and electric top-ups and supports for those who are shielding or self-isolating, mental health support, crisis support and bereavement support, and a whole range of other issues that people may like support with. We support people who have not previously engaged with support services to help them understand the lay of the land and what is available to help them, and also those who have previously received support to ensure that they receive the ongoing support that they need. We are also very aware of being flexible and adaptable to keep up to date with the ever-changing response during COVID-19 from community organisations, to ensure that we bridge the gap, because COVID-19 impacts services in a variety of ways, and we want to make sure no one is left behind. Regarding the longer term impact of COVID-19, I think it's absolutely key that for the community links practitioner role, we will not only continue to support people during lockdown, but as we emerge, excuse me, as we emerge through the different phases and in the longer term as well. I think it will take some time to truly understand the longer term impacts of the pandemic, and I think it will be absolutely essential that more resources are made available to support our communities to rebuild.
Thanks very much, everyone. So I'm going to move on from our individual questions, and now I have a question for all of you, and we'll take it in turns. I'll ask Janine first. Same question for everyone. To you, what is the most important element of being a community links practitioner?
For me, the most important element of being a community links practitioner is relationships. It's really essential that you build relationships, first of all, with the people that you're supporting, all of your colleagues, whether that be in the Alliance or whether it's in your own GP practice where you're based, and across the statutory organisations and other third sector organisations. So we do lots and lots of networking and really lots of stuff to find out what else is going on out there in the community so that we can link people into the appropriate places.
Thank you. And Chris?
I would say our kind of, truly person-centred approach is one of the most kind of important aspects of our job, and our, sometimes quite unique ability to meet with someone without us approaching them with an agenda and being fully led by the individual and their needs and what they want to do in relation to what's important to them.
Thank you. And Jeff?
For me, excuse me, for me, it's flexibility and to really listen to people by asking them what matters to you to support them with the most important things for them.
Thank you. So relationships, person-centred approach and flexibility. Well, thank you all for taking the time to speak to me today. It has been so interesting hearing about the work of community links practitioners and also how your role has changed and what you think will be needed into the future. And thank you also to our viewers. I hope you've enjoyed hearing about this as much as I have. Alliance Live will continue to release interviews, podcasts and webinars. More information regarding these and the wider work of the Alliance can be found on our website at www.alliance-scotland.org.uk or follow us on Twitter @AllianceScot. Have a lovely day.